right, please be seated. State's next witness. All right, Elizabeth Parnell is a nurse practitioner, which means that she is an expert in a particular field. Will the defense stipulate that she is an expert in her field? All right, they have so stipulated, so she will be testifying as an expert. Raise your right hand.
Do you swear or affirm the testimony you're about to give to be the truth, the whole truth, and nothing but the truth, so help you God? Yes.
Would you please tell us your name and spell both your first and last name for us?
Yes, it's Catherine Elizabeth Parnell. My first name is Kathryn, and my last name is Parnell, Parnell.
And that answers one of the things probably, because I refer to you as Catherine Parnell and the judge as Elizabeth, so.
I go by my middle name, Elizabeth. So.
Okay. And here we'll say Miss Parnell, if that's all right. And you were coming in, the judge was talking about your having expertise in an area. What is it that you do?
I am a women's health nurse practitioner, and I'm also certified as a sexual assault nurse examiner for adults.
Right. And have you testified as an expert in that field in various occasions in different courts?
Yes.
Okay. And Your Honor, I have provided a copy of her CV to counsel. If I could ask this be passed up. Ms. Parnell, you're being handed a document which I believe you provided to me. What is that?
This is my CV, or my curriculum vitae.
Okay. Now, Your Honor, I would tender that as the next number exhibit.
All right, that'll be 65, I believe. Yes. 65. Thank you.
And again, since we don't have to go through all of the usual qualifying questions, could you just tell us a little bit about yourself? Where did you go to college and experience and training, things of that nature?
Yes, I have a bachelor's degree in biology from Lipscomb University, a master's of science degree in nursing from Vanderbilt University, and then my certifications, as I mentioned before, I'm certified as a women's health nurse practitioner and as a sexual assault nurse examiner for adults.
What do you do as a sexual assault nurse examiner? What does that entail?
Yes. Here in Nashville, there's a team of us that work. We perform sexual assault exams here in Davidson County. We take call on 12-hour shifts. We carry a pager with us and our cell phone, and we respond to pages or phone calls that we get from the emergency department. So when I go to the hospital, when I'm paged, I meet with the victim, I obtain consent, I obtain a health history from her and an account of the events that led her to present to the hospital. I perform a physical exam to look for any injuries. I collect evidence as I perform the physical exam, and then I offer her prophylactic antibiotic treatment for sexually transmitted infections that she may have contracted during the assault, and also discuss follow-up testing with her.
Right. And I believe you, a few moments ago, said deal primarily, if not exclusively, with adults?
Yes. Our team sees female victims age 16 and up.
Okay. I was going to ask the age. So it's 16 and up.
Yes.
Let me instruct you on something. And would you, if it comes up, try not to use the victim's name, just refer to it as the victim, all right?
Yes, sir.
And actually, Judge, I think if I might have just a little bit of liberty, in the course of the paperwork that's generated, is the person referred to as patient on occasion, or?
As patient or as victim interchangeably at times.
Okay, and the only reason I ask that is either, if you could use either of those terms.
Yes.
Okay. Just, thank you. Now, for the benefit of the jury, are these examinations done at all of the hospitals in Nashville, or how does that work?
Here in Nashville, we see victims at Nashville General Hospital and also at Vanderbilt University Medical Center.
Okay. And is there any particular reason someone would be seen at one place as opposed to the other?
Typically, we see patients at Nashville General. We go to Vanderbilt to see employees, students, and any victims that may require treatment in the trauma intensive care unit.
All right. And pardon me, over the years, has a procedure or a protocol been developed with respect to these examinations?
Yes.
Okay. And is that part of the specialized training?
Yes.
Are you called out by police, by the hospital? Does it vary? How?
We could be called by a detective, or we could be called by a nurse in the emergency department, typically by one of those two entities.
Your Honor, could I ask that, I believe it's exhibit number 12, but I wouldn't swear to it, the MLE kit.
All right.
May I see that just for a second? Number 8. No. I just wanted to make sure what number I was talking about.
Okay.
It's exhibit number 8 that you've been handed. Could you tell us what that is and how, if at all, that has an interaction with your job?
Yes, this is an evidence collection kit, or what we more commonly refer to as a rape kit. And as I perform the physical exam and collect the evidence, I package it and place it in this kit.
Okay. And are those, where are those generally stockpiled?
At the hospital. They're in a cabinet at the hospital.
Okay. Now, with respect to that particular item, exhibit number 8, do you recognize it as having been collected and or dealt with by you?
Yes.
Okay. And does that contain, among other things, the victim's name and case number?
Yes.
All right. Now, with respect to the young lady in question in this case, when I asked back in June of 2013, were you paged, called, buzzed, beeped, or whatever to become involved in this incident?
I was, yes.
And you remember approximately what time of the day or night?
It was in the afternoon. I can't tell you exactly what time it was.
Okay. And do you remember, from memory, who contacted you?
I believe it was Detective Mayo.
Right. And do you recall where you went?
I went to Vanderbilt University Medical Center to the emergency department.
And, Your Honor, if I could have this document, counsel has one or more copies, be passed to Nurse Parnell.
Thank you.
Ms. Parnell, you're being, pardon me, handed a document to ask if you would, look, could she still have that? Is that all right?
It's fine.
I don't think it'll, you just set it aside.
Okay.
Be working. Could you look at that document and tell us whether or not it is a report concerning your examination of the young lady in question?
Yes, it is.
Okay. And does that have, and again, we're not going to be displaying this necessarily, but does it contain the victim's name,
Yes.
date of birth,
Yes.
all right, and a consent form?
Yes.
Okay. And does it also contain in this the referring detective?
Yes.
And who was that?
That was Jason Mayo.
And does it have a complaint number that's associated with the case?
Yes.
What is that number?
It's 13-0607509.
And does that number correspond to exhibit number 8? A lot of numbers and things on
I was going to say there's a lot of numbers on here. I don't see that particular number on here.
But does that?
I believe it has the identifying information from Vanderbilt Medical Center, the patient sticker, and then I believe it has some information and lab numbers from what would be the TBI.
Okay. Only point is, does it correspond to your written report?
It does.
Okay.
Yeah.
That's all. I don't think we have any further need of it because I'm not going to ask you to
Okay.
open it. Thank you, Mr. Fields. Now, on page 1, and how many pages are there of this report?
6 pages.
Okay. If we perhaps, and again, for the reason I'm going to sort of walk through page by page, does it have a time of when you would have started or at least begun the examination?
It notes that she was admitted to the ER at 1700, which would have been 5 p.m.
Okay. If you could, not with respect to her particularly, but describe where she was when you encountered her as far as the hospital. I know you said emergency room, but...
She was in the emergency department. She was in a triage room when I first met with her, and then through the course of our interaction, she was moved into an exam room.
Okay. And when you first met her in the triage room, had she already been put in a hospital gown or...
No, not at that point. She was not in a hospital gown.
Okay.
I typically meet with a patient clothed first and then interview them and then have them change clothes.
Okay. And was that procedure followed in this case?
Yes.
Okay. And would that have been when you would have gotten the information on page 1?
Yes, page 1 and page 2 would have been completed with the patient clothed.
All right. And with respect to information, do you obtain a history from the person?
Yes, we obtain a brief health history and then an account of what had brought her to the hospital.
Okay. And are these statements or this account, is that for the purpose of medical purpose of diagnosis and treatment?
Yes, and also for evidence collection.
Yes.
Yes.
Did you explain to the victim the process that she would be going through?
Yes, I have the patient sign the consent form, but I let them know if there's part of the exam that they don't feel comfortable proceeding with. Certainly it's an ongoing consent process. They can say no at any time. So.
Okay. And what is that process that the person would be able to say, no, stop?
Well, if there's something that's uncomfortable for them or painful for them or just something that they don't want to have done, they can voice that, and I'll respect that.
Okay. And in this particular case, did the victim consent to go through the entire procedure?
She did.
And
yes.
Did go through it?
Yes.
All right. So you're talking with her clothed in the room, getting the history. In looking at page 2, could you tell us a little bit about what information was obtained?
Yes. As far as her health history or as far as the assault complaint?
Pardon me, a little bit of both with respect to any previous history, allergies, things. Were those the types of things you asked about?
Yes. We asked about psychiatric history, which there was none. Previous rapes or assaults, none. She noted that she was allergic to penicillin and amoxicillin. Her past surgeries included surgery on her left eyelid in 2011, and she noted that she'd been hospitalized at age 5 for a reason unknown to her. She did not have any significant medical history at that time, such as asthma, high blood pressure, diabetes. She did note that she took 2 medications, oral contraceptive pills and fluoxetine for bereavement.
Okay, and just for the sake of is that an appropriate drug for that issue?
Yes.
Now, with respect to your being there in her presence, did she appear to be an otherwise healthy young woman?
Yes.
Okay. Consistent with the history?
Yes.
Now, in going on to taking that part of the history with the forensic application, did you discuss with her or ask her questions about her presentation to you for the examination?
Yes. I noted last thing she remembers being at Tin Roof talking to friends about midnight, waking up at 8 a.m. alone in the bedroom with one of my friends, and then parentheses, friend's bedroom, Brandon Vandenburg.
Okay. Did you, as part of the form, attempt to obtain other information about what had occurred?
Yes.
Was she, excuse me, I didn't mean to interrupt. Was she able to give you an account of what had occurred?
No, not beyond the description that I just read. It was unknown to her whether her vulva, her mouth, or her anus had been penetrated, whether there had been ejaculation, whether or not a condom had been worn.
Okay. Now, Ms. Parnell, given the date and the time you told us that the examination began at Vanderbilt around 5 o'clock on the 26th, were you aware, for the purpose of your investigation and examination rather, the time frame of when the assault was supposed to have occurred?
I was aware that we were outside of the 72-hour window that we typically use.
Now, could you explain that to us from expert?
It becomes more difficult to collect biological evidence after 72 hours. It's still possible, but just depending on whether the patient showered or bathed or douched, it can become difficult to collect the evidence.
Okay. And we're talking about, I take it, a person who's alive, moving, and engaging in daily activities.
Yes.
And were those types of questions asked of the victim that you just said, of what had she been doing?
Yes, they were. Yes. I noted that since the alleged assault, patient had bathed or showered, she had changed clothes, she had had something to eat or drink, she had had a bowel movement, she had urinated and brushed her teeth.
Okay. And given those answers, did you go ahead and conduct the examination?
Yes, we did.
Okay. And during that period of time and asking those questions, were there any other comments with respect to the history that you obtained on page 2?
Yes. We asked about the last voluntary intercourse that the patient has had, and that was noted as happening on 6/23/13 about 5 p.m., and it was vaginal intercourse.
And did she name the person that was with?
It was with Brandon Vandenburg, and she told me that her partner had not worn a condom, he had not had a vasectomy, and that she had not douched after intercourse.
Now, on page 2, were there any additional notations with respect to the incident in question?
I noted patient states she did drink quite a bit of alcohol, mixed drinks and shots. Patient reports she drank more than usual and that a woman was buying drinks for her group of friends.
Now, this part of the examination, it's still just you and she talking, correct?
Correct.
Okay. Do you recall anything about her demeanor, her appearance, anything of that nature?
I noted on page 3 that she had a controlled response. We document the emotional response of an assault victim as either controlled or expressed. So I noted controlled, and that tells me that she was calm and composed. I also noted that her clothing was intact and that she asked appropriate questions.
Okay. And was there anything unusual about that?
No.
And is there anything such as a typical rape victim?
No.
Or typical response? Or
no.
At this point, are you through basically with the asking questions
Yes.
part of it?
Yes.
What comes next?
The physical exam comes next, where I would look for injuries and collect evidence.
Let me just ask this. At this point, with getting the information and talking with her, was she able to give you any specifics of even whether she had been penetrated or any information?
No, not no specifics.
Other than last memory and waking up.
Right.
Okay, you're going to the examination. What do you do? And again, how do you conduct that?
So I would have her change clothes and put on a hospital gown. I would give her a sheet to drape with, and then I would collect swabs above the waist. So I would collect the swabs from her mouth, from the inside of her cheeks, and then I would perform the pelvic exam and collect swabs from her vulva and her vagina, and then I would document any scratches or bruises that I noted.
Okay. And did you note any scratches, bruises, any type of injuries?
I did on page 3.
Okay. And, Your Honor, if I could put this up on the overhead.
All right.
Redact it all. Everything except the actual chart.
All right.
Sleep, you touch the screens. Zoom in. Let's go through it. Can you say?
Yes.
Yeah.
Yes.
Okay. And what is this we're looking at?
This is a body diagram where I drew pictures of the bruises or other injuries.
And I believe as we can see, there are also the little boxes that you can check
Yes.
on the left.
Yes.
If you would just sort of walk us through that, and I believe the screen, you could touch it, it'll show, and then we can erase it.
I noted physical trauma on her extremities and her buttocks. I checked yes on those 2 boxes. And then if we look at her just below her right knee, a 3 centimeter by 3 centimeter wound, scabbed at present time, red in border. And then if we look at her, the front of her left thigh, starting at the top, a 4 centimeter by 2 centimeter purple bruise.
Ms. Parnell.
Yes.
As I asked before, could you kind of give the jury some idea of what 3 centimeters and 4 centimeters are?
Yes, sir. So this is 3 centimeters between my 2 index fingers. I think later there will be one that's 6 centimeters, so 6 centimeters, and then 1 centimeter, just for perspective.
Can you say that in inches? Like 3 centimeters is what, about an inch, inch and a half?
3 centimeters is a little bit over an inch, yes.
Okay. All right. That gives them some perspective, as well as me.
Okay, yes.
And I knew you had brought that with you, and so thank you. You continue just noting the other.
Yes. On the front of her left thigh, in the middle, a 2 centimeter by 1 centimeter purple bruise. And then below that, a 3.5 centimeter by 2.5 centimeter purple bruise. And then just below her left buttocks, a 4 centimeter by 2 centimeter purple and red bruise. And then a 6 centimeter by 2 centimeter purple bruise. And then on her right buttocks, a 3 centimeter by 1 centimeter linear red bruise, a 4.5 centimeter by 2.5 centimeter yellow and brown bruise, and then 2 bruises, each 1 centimeter by 2 centimeters, that were yellow and brown. Also on the back of her left lower leg, on her calf, a 2 centimeter by 2 centimeter purple bruise. And then scratches on the lateral aspects of her right and left ankle, so the outsides of her right and left ankle that were scabs and red.
Not having been there when these were incurred, do you have any way of knowing how they were incurred or what the mechanism was?
I do not, no.
Or if I could tender this as sort of a standalone.
All right, that's fine. Sure. That would be number 66.
Thank you. And would that essentially be the external examination?
Yes. The external examination of the body. There's also an external examination of the genitalia, and that's noted on the next page.
Okay, so as we go to the next page, if you sort of walk us through that verbally as to what
Yes.
you...
On the Mons, I noted mostly shaved, normal hair pattern without lesion. And then on the vulva, mostly shaved, normal hair pattern. Looks like I repeated myself, and then without lesion. And then vagina, I noted scant white discharge and vaginal vault, no visible trauma. I noted that her cervical os was closed. Her uterus and adnexa, so her ovaries were not, I did not examine those. And then her rectum, no visible trauma, no complaints of pain or discomfort.
In other words, no evidence of injury.
Correct.
Okay. Does that mean anything one way or the other as to whether or not she had possibly been sexually penetrated?
It does not. The genital tissue is elastic and very vascular, so any injuries that occur heal very quickly without scarring usually. And genital injuries are most likely to be identified on exams that occur within the first 48 hours after the assault. So on any patient I see, it's not surprising to me when I don't find a genital injury.
And with respect to her age, did you get her age at the time?
Yes, she was 21 years old. So she is of childbearing age, which tells me that her genital tissues are also under the effect of estrogen, which is just another reason that we would be less likely to find an injury as opposed to a young child or a woman who is no longer having menses. Those tissues are weaker because they do not have estrogen.
Okay. And I believe previously you said she appeared to be very healthy and...
Yes. Yes.
So, did you essentially prepare a summary of your findings following your examination?
Yes. Noted on page 5. I noted that her urine pregnancy test was negative. Patient outside window for HIV prophylaxis and is okay with not taking it. She had a tetanus vaccine in 2007. Recommended patient to follow up with Vandy Student Health Center regarding follow-up tests and lab results. Patient verbalizes understanding. No further questions at this time. Patient given phone number for sexual assault center in case she decides she desires or needs counseling. Bacitracin ointment given for knee. Instructed her to follow up with Student Health Center if knee wound worsened.
About how long did this entire process take?
It usually takes about 3 hours. So, the next page, it's noted that I finished, that I made the checklist of what went into the kit at 19:15, so it's 7:15. So
A little over 2 hours.
Yeah.
In this case. Okay. Not going to ask him to hand you the kit back yet, or ever, but exhibit number 8, the MLE evidence collection kit. Tell us a little bit about that. What does that contain and/or what do you put in it?
It contains envelopes and swabs, longer Q-tips. It also contains, I noted that I collected pubic hair combing, so it contains a comb and something that those are brushed into, and that seems to be what was collected on that day. Occasionally we collect underwear.
Okay,
So,
clothing, but
yes.
obviously time.
Yes.
Okay. And with respect to the evidence collection, a few minutes ago you talked about obtaining swabs from, I believe you said her cheek, mouth. How is that done? And what is the purpose of that?
Yes, we collect swabs from the inside of her cheeks to test for her DNA, so that the lab has her DNA. And then I collected pubic hair combings, labial swabs, vaginal swabs, a rectal swab, 2 perianal swabs, 2 gum line swabs, the DNA buccal swabs from the inside of her cheeks that I noted, and then 2 swabs of what I noted as vaginal pool. And then some blood tests that did not go into the kit.
Okay. And are there items collected, blood, urine, that are liquid that don't go in the kit?
Yes.
Okay.
Yes.
And were those collected notwithstanding the time frame?
Correct.
Okay. And why, if you're outside the window?
Well,
In other words, why did you go ahead and collect all these things, even if it was outside the
we knew there was
72-hour window?
still a chance that we could collect some DNA. Had an assault occurred, and then we collected the tests for sexually transmitted infections are collected anyways. So.
Okay, so that's for the patient's benefit?
Yes, so that she can be treated, yeah.
Okay. I would tender the report that she has been reading from, not reading from, but referencing that she prepared. You did prepare this report,
I
correct?
did, yes.
Okay. As the next numbered exhibit in this matter.
All right.
And
Number 67.
those are my questions.
All right. Cross-examination.
Just a brief, out of your script, sharing the text.
All right, very brief.
Ms. Parnell?
Yes.
Good afternoon. You noted in your report, were you the first individual to encounter the alleged victim in this matter? I'm sorry. Were you the first individual that encountered the alleged victim when you got to Vanderbilt University?
No, she was in a triage room, to the best of my memory, with someone actually triaging her. I'm not sure whether it was a nurse or...
Please explain triage. I've never known that.
So when the patients arrive in the emergency department, they meet with a nurse to so that they can tell the nurse what their complaint is, get their vital signs, and assign an acuity level to them. So whether it's an urgent, they need to be seen urgently, or it's okay to put them back in the waiting room. So to the best of my memory, she was in a triage room.
Okay.
With a member of the staff from the emergency department.
Okay. Do you know if there was a detective present in that room?
I do not. I recall him being in the emergency department, but I don't recall if he was in the room. The rooms are very small. I I don't know.
You said you had received a call from Detective Mayo prior to you visiting with the alleged victim in this case at Vanderbilt.
Yes.
Okay. And do you know if the detective transported the alleged victim to the hospital? Do you know?
I do not know.
Okay. And you don't know if the alleged victim was accompanied by the detective in the triage room when you first encountered her?
I do not know.
Okay. And do you know if the alleged victim in this case voluntarily came to Vanderbilt Medical Center?
Your Honor, I object to the relevance.
Well, I think that's a question that's really already been asked. So, and whether she knows or not, it doesn't really matter.
You indicated in your report you were talking about controlled responses.
Yes.
Is that correct? And when you're engaging, when you were engaging your patients, I believe the Attorney General referred to them as patients, do you note whether they are voluntarily responsive to your questions or reserved?
I don't think I explained myself well. Rape trauma syndrome is something, it's a syndrome that we talk about as forensic nurses. When we evaluate the patient's emotional response in the acute phase of rape trauma syndrome, we either refer to it as a controlled response, meaning she would have control of her emotions or control of her body, meaning that emotionally she was under control, or we refer to it as an expressed response. Had I recorded that her emotional response was expressed, that would have told me she was agitated, shaking, sobbing, crying, one of those things. So controlled response is more just her demeanor.
Okay. And I believe you testified she was calm and composed?
I did.
Okay. And when you finished your interview of the alleged victim in this case, did she leave and go home, only if you know, or was she further processed through areas of your department?
No, she would have left and gone home.
Okay. Do you know whether she met with a social worker or not?
I do not know.
Okay. And would you have reviewed those notes if she had met with a social worker?
No, I would not have had access to those notes.
Okay. So the only notes you have access to are the notes that you create and generate?
That's correct.
Okay. And you noted that there was no bruising or trauma to the genitalia area. Is that correct?
That's correct.
Okay. Judge, if we could please pass Ms. Parnell exhibit, I believe it was 8.
The
MLE kit.
Okay.
You looked really hard for some numbers on that MLE kit. Are you able to find those numbers that correspond with your report?
I am responsible for putting the patient sticker on the MLE kit, and beyond that, I don't write anything or put anything else on it.
How do you get the MLE kit?
Before it's processed.
Okay. Who gives it to you? Do you have it in a storage area?
They're in a cabinet in the emergency department, yes.
Okay. Would you have retrieved that MLE kit yourself?
Yes.
Okay. So it's your testimony that you retrieved that MLE kit?
Yes.
Okay. And then when you...
And I would have opened it myself.
You would have opened it yourself. Worn gloves?
Yes. Okay. Well, yes. Worn gloves when collecting and when packaging.
Okay. Mm-hmm. And when you're completed with your packaging, when you place those items where you have retrieved specimens and those type things, you package it back in your MLE kit, right?
That's correct.
And then where does it go from there?
In this case, it went with Detective Mayo.
Okay. And did you affix a sticker to that particular MLE kit?
I did.
Okay. How can you identify that as a sticker that you would have placed on that?
It's the same stickers that I placed on her chart.
Okay. And are there identifying sequences of numbers on the stickers that you would have placed on her chart that should identify that package also?
Yes, a medical record number and a case number.
Okay. And after you handed that to Detective Mayo, you don't know where the MLE kit went from there, correct?
No, I did not accompany it after I gave it to him.
Have you met with the alleged victim after your first interview?
No,
Okay. Haven't spoken to her again?
no.
Okay. You noted on page 2 of your report, and this is information that I garner you took from the alleged victim. She was conveying this information to you?
Yes.
Is that right? And she stated that a woman was buying drinks for her. Is that group of friends?
I don't have it in front of me, but I believe it was for her group of friends, yes.
Do you want to look,
Yes.
look at it just to make sure?
Yeah.
I think it's Exhibit 65, 66. 67.
Yes, for her group of friends.
A woman was buying drinks for her group of friends, correct?
Correct.
Don't have anything further on.
All right, ready to wrap?
Told us about General Hospital, so are there empty MLE kits stored at Vanderbilt as well?
Not to my knowledge.
Okay, so is it possible this came from General Hospital via Detective Mayo?
This particular kit, I keep one with me in case I get paged to Vanderbilt. So I took one out of the cabinet at General and I keep it in my work bag. So I had one with me that day that was unsealed, that was sealed, that I took with me to Vanderbilt.
Okay, so do you know if Detective Mayo had one as well?
He may have, because he's very responsible, so he may have had one.
Okay, that's all I wanted to know. Judge, it's been so long, but I think Exhibit 8 may have been introduced originally just for identification, but if that's the case, I would move its submission as an exhibit in its entirety.
Let me check real quick.
May not have. I know I made some reference to subject to connecting up, but
I think Detective Mayo did have, well, I'll tell you in just a second. I have it as an exhibit.
that's fine. I just want to be overly clear.
Do you have it as an
No.
exhibit? All right.
Thank you. That's all I have.
All right. Anything further?
Further,
All right. Thank you. Mr. Finance. Okay. State has how many witnesses left? One witness? Okay, let's take 10 minutes and then state's last witness is coming. All rise.